Now, of the causes of nasal congestion that we reviewed earlier, which are some of the most common that you see that can lead to this sort of irritation in the nose?
Most common, I would say, we see a lot of people with allergies. We see a lot of people who have a deviated septum.
Okay.
We see a lot of people that have allergy leading to chronic sinusitis, so either constant or recurrent sinus infections. Any of those conditions come through quite commonly, and we attempt to treat them medically initially, but very often by the time people have come to see us as specialists, they've been on every medication, they've been on every nasal spray, they've seen their primary care.
You are their last hope.
So that, not necessarily the last hope, but as a specialist, we can offer them a definitive solution that they maybe didn't know was available.
Now, with someone who has a recurring sinus infections, is that treatable?
Absolutely.
It is?
Yes. Typically, you treat them with medical therapy, which is actually over an extended period of time. If that fails, then there are interventions that you can do to prevent them from having recurrent sinus infections.
Okay. Now, it seems that when I get a cold, there's always usually one side of my nose that gets clogged and stuffier than the other. So why does this happen?
That might be based on the anatomy of your nose. If your septum, the wall that separates both sides, is deviated toward one side, if the tissues in your nose called turbinates are larger on one side than the other, then a little bit of swelling from a cold or allergies can block that side really badly, but not the other one as much. So usually that's a sign that something in your anatomy is slightly asymmetric and potentially could be corrected.